You're welcome. This is Medicine and Medical Nursing. This is Academia, Mr. Malambo, the admin. Thank you so much for supporting our page, and richly God bless you. We are going to consider pneumonia as one of the medical conditions. The question, you see, it was extracted from one of the NMCZ past paper, and therefore we are going to tackle it. The question says, Mr. Jeremiah Jerry, a miner from Konkola Copper Mine PLC, is admitted to your medical ward with history of a dry cough and chest pains. On examination, a diagnosis of lobar pneumonia is made. The first question says, state 5 other signs and symptoms of lobar pneumonia other than those mentioned above. B says, mention 5 causes of pneumonia or causes of pneumonia. C says, describe the management of Mr. Jerry while in hospital till discharge. We are given 50%. Then D says, explain 5 complications of pneumonia, 25%. Now, looking at the nature of the question itself, you will discover to say, from the foundation that is given us, Mr. Jeremiah happens to be the miner from Konkola Copper Mine, and is actually admitted to the medical ward with a history of dry cough and chest pains. On examination, a diagnosis of lobar pneumonia is made. Then the question relates that from the background given. It says state 5 other signs and symptoms of lobar pneumonia other than those mentioned above. Which ones are those mentioned? 1, dry cough and chest pains. Now, apart from these two, we are told, can we now state other 5 signs and symptoms other than those mentioned? Answer number 1. Signs and symptoms number 1 other than those mentioned, it is nasopharynx. This is actually due to poor ventilation and labored, breathing. Number 2, dizziness due to poor ventilation as a result of inflammation in the lungs. Then number 3, cyanosis, which is actually due to hypoxia. Fever, which is also due to the presence of the infection and other infections to say. Nausea and vomiting, which is due to gastrointestinal tract involvement and disturbance. General body malaise, which is due to hypoxia. Joint or rather muscle pains due to tissue hypoxia. From these you can actually choose signs and symptoms. We go to question B. It says mention 5 causes of pneumonia. 5 causes of pneumonia. So we need to mention number 1, it's chronic bronchitis. Number 2, viral infections such as measles, which affects the respiratory tract and also reduces the immunity. Number 3, inhalation of foreign material into the respiratory tract, which later descends into the lower respiratory tract, causing pneumonia. Then number 3, obstruction of the respiratory tract by growth, e.g. it can be cancer, which actually leads to retention of fluids and secretions in the lung tissue. This fluid eventually becomes infected. Then number 5, prolonged to cold, which irritates the respiratory tract and reduces the ability of cilia to expel the foreign bodies, including microorganisms. Okay, so this actually raises the risk of microorganisms invading the respiratory tract. So those are the cause of pneumonia. Question C says, describe the management of Mr. Jerry while in hospital till discharge. Now, when you look at the management of Mr. Jerry, we are actually looking at how we can manage from hospitalization till discharge. From the time he was taken to the medical ward where he was actually managed to until discharge, meaning until he becomes well. So how can we explain the management of Mr. Jerry? So one, you need to set what are called aims, or rather objectives. Things you are going to work upon to make Mr. Jerry become well. Number one, under aims, you need to relieve dizziness. Number two, to promote quick recovery. Then number three, to prevent septicemia. Now, you can also write other aims. Okay, you can include them. It depends on how you approach this particular question. So you start with the aims, investigations. Then from the investigations, you go to treatment. Then now nursing care, where you are going to explain this particular management in detail. All right, let's give it a try and let's answer it based on the nature of the question's approach. So one, aims. Like I said, to relieve dizziness. Number two, to promote quick recovery. Then to prevent septicemia. Those are the objectives I will consider to manage Mr. Jerry. The second point is investigations. So under investigation, what am I going to investigate? One, history from the patient, which actually may reveal stabbing chest pains made worse by deep breathing or cough. On auscultation, there will be a reduced air entry and cracking sounds called riots in the affected lung. On percussion, there will be dullness on the affected side due to consideration or consolidation of the underlying lung. Okay, sputum for my microscope. Okay, culture and sensitivity will actually demonstrate the causative agent and the specific drug to be used. Okay, white blood cell count. Actually, even this one will show elevated leukocyte count. Blood culture, which then would show the causative agent if bacteremia is present. And computerized tomography will show pneumonia even where chest x-ray cannot. You can also use chest x-ray, which will actually show areas of opacity, okay, as seen as white, patches respectively. So these are the investigations that I'll actually do. Treatment. So under treatment, you can also talk about the route, dose, frequency, nursing, and also implications of the drugs that are actually used. So we are saying bacterial infection, you give antibiotics such as crystalline penicillin. For analgesics and antipyretics, give Panadol. Oxygen therapy, to counteract, I pause. If the infection was fungal, until fungal have to be used, the antifungal really has to be used. Bronchodilators such as Ventolin of about 2 to 4 milligram TID. So this is about treatment. So the approach for investigation, aims, and treatment are included under management. Let's now look at nursing care under management. We are still under management. So what are we saying? Things to consider, like I said: aims, investigation, treatment, then nursing care. So we are under nursing care. That is the flow of the management itself until Mr. Jerry is discharged. So under nursing care, what do you need to consider? 1, environment. Under environment, Mr. Jerry will be nursed on a well-ventilated room to prevent other respiratory tract infection. He will be nursed in a well-light room for easy observation and for orientation to time and place. So the patient is going to be nursed in a general ward, but reverse barrier nursing will be used to prevent acquisitions of nosocomial infections. We will also include oxygen and giving apparatus for use because Mr. Jerry is dyspneic. I will include the drip stand in the room for IV when need arises. So this is how you approach the environment. The next point is position. So under position, Mr. Jerry will be nursed in a phallus position to promote lung expansion and relieve dyspnea. I will change the patient's position 2 hourly to prevent development of pressure sores. So as the condition improves, I will let the patient adopt any position of comfort to promote what? To promote rest. This is how you approach position. We go to the other point, rest. Okay, rest. So under rest, this is how you approach it. 1, I will nurse the patient in a quiet room to promote rest. I will play the radio at low volume to promote rest also. I will answer all phone calls promptly to prevent disturbing the patient, thereby promote rest. I will do related procedures in blocks to promote rest, and I will administer prescribed analgesics in order to promote what? Rest. And I will ensure that squeezing trolleys are all oiled to prevent noise and thereby promote rest. We go to the other point, observation. So under observation, you need to observe Mr. Jerry as he is admitted. So how? So you will do vital signs and BP to act as the baseline data in order to know if the condition is improving or rather deteriorating. I will observe for cyanosis if improving or getting worse and give oxygen therapy when necessary. I will observe for dyspnea. If present, we will prop up the patient to promote lung expansion, thereby relieving dyspnea. I will observe the pressure area to detect an we can even write this as set of pressure sore development. I will observe the sputum for color, amount, and consistency to detect what is called uh, hemolysis and report to the physician if any. I will observe the patient's facial expressions to detect pain and administer prescribed analgesics like paracetamol and observe the action and side effects. I will observe the feeding pattern of my patient and take measures like giving small frequent meals to promote appetite. I will observe their respirations to detect tachycardia and report accordingly. Okay, so that is how you are going to do it for Mr. Jerry. We go to the other point, psychological care. I will explain the disease process in order to raise the knowledge levels and thereby allay anxiety. I will encourage the patient to ask questions and I will answer accordingly. To those I cannot answer, I will refer to the physician. It is not all the time that people will know. Okay? It is important not to showcase or maybe to show yourself positively that you know it all. Where you don't know, learn to humble and ask for good approach. Actually, when you ask questions where you do not know, you are learning more. Okay, so it's imperative that it is done likewise. So I will explain all procedures to Mr. Jerry in order to allay anxiety. Okay, so I will also involve a successfully managed case to come and talk to my patient in order to allow the patient, ask pressing questions and get answer. This will actually improve patient's outlook on his condition. Okay, I will provide diversional therapy in order to shift the patient's mind from the hospital routine and his condition. I will explain to him that as the healthcare team, we are doing everything possible to ensure that he gets better in order to promote cooperation. And hygiene. Hygiene is important. So I will encourage Mr. Jerry to take plunge baths in order to promote dead epithelium and promote comfort. I will do hair care to promote self-esteem and also prevent other foreign bodies to affect him per se. I will do nail care to prevent auto-infection. And I also do mouth care to prevent halitosis. So any soiled linen and clothes will be changed to promote comfort. So this is what is done to Mr. Jeremiah. Under elimination, so I will provide a lot of fluids and roughage to prevent constipation from him. I will prove Cooper's fluids in order to promote renal washout and thereby preventing renal problems. I will offer a bed pen if he is confined to be on bed to ensure bowel movement. Nutrition. So under nutrition, you talk about things you should provide in terms of food that is going to speed up his healing. So I will provide energy-giving foods like Nshima to provide the energy needed for metabolic processes. Then I will provide protein foods like fish and beans to promote replacement of worn-out tissues. Vegetables and fruits will be provided to raise the immunity and promote skin and mucous membrane integrity. I will provide a lot of oral fluids to prevent dehydration due to excessive sweating and promote bringing up all phlegm. I will serve small frequent meals to promote appetite, and I will allow visitors to bring food prepared by the patient in order to promote appetite. Then I will do regular mouth washes in order to promote what? Appetite. Very important. Exercise. If my patient is confined to bed, I will do passive exercises like limb, movement and massage in order to prevent muscle atrophy and promote blood circulation. I will encourage the patient to do deep breathing exercises in order to promote lung expansion, and I will encourage early ambulation as soon as the condition permits in order to prevent deep vein thrombosis and other complications of immobility. Medication. I will administer prescribed analgesic like Panadol at the right time to promote rest. Then I will also give prescribed antibiotics like Expen to promote quick recovery. I will ensure that the drugs are swallowed in my presence to promote recovery. Those that basically may not take the drug to say. So you need to be there as they are taking the particular drug. Right, then from there, you talk about IEC. You will educate the patient about his condition in order to create awareness and prevent recurrence of the condition. So you also need to explain the need for taking the medication in order to promote compliance and educate the patient about the signs and symptoms of the condition for early diagnosis and treatment, thereby preventing complication. Talk to the patient about the need to take a balanced diet using locally available foods in order to boost the immunity. Also educate Mr. J about the need to keep the review dates so that his progress is monitored to ensure full recovery. Advise the patient to avoid smoking to prevent continued irritation of the air, airway, thereby preventing recurrence of the condition. So it's important in that way. So these are actually given when he is about to be discharged. You educate the patient. It's also important to advise him to keep warm in order to prevent asthmatic attacks. Okay, you basically teach them likewise. Right, the last question says, explain 5 complications of pneumonia. Explain 5 complications of pneumonia. So complications of pneumonia: 1, we've got what is called the emphysema, septicemia, and the pleural infusion, and others. Now, from what has been given, we are told to explain 25, so you need to explain. Those are the summary you can add on. Otherwise, thank you so much for your time, and God bless you, even as we continue looking at other particular conditions. This was Mr. Malambo. Thank you so much for your attention.